So here we have a pretty simple spacer, but it's actually going to save us the ability to make sure that we manage our stock of meter dose inhalers. So one of the things that we decided, or one of the things that has been recommended, is no aerosolized out into the open. So what you have seen in the last couple of videos have been ideas and suggestions and things that we worked on to minimize that aerosolization to the public and to especially to our workers here with the closed CPAP, the closed nebulizer for the pediatric patients, also the mask and also the ventilator. But now we're talking about a spacer, and what we've decided to do is, with the help of the infection control department, is to be able to go ahead and maximize the amount of inhalers that we use by basically using what we call a common canister approach. And basically what it means is that every patient is going to receive their own spacer with their name on it. We can put a patient label on it, we can scribble their name, however it is that anybody wants to identify. Here we're going to put the patient's label on it, and this will remain with the patient. So we'll have 3 patients, the 3 patients will receive one. The respiratory care practitioner will then go ahead and have their own inhaler, and before administering the MDI to the first patient, they'll wipe it down with alcohol, administer the inhaler to the patient. Now, of course, the one thing here is that the respiratory care practitioner is the only ones who are going to be touching the inhaler itself. It is not going to be self-administered by the patient itself. It's going to be administered by the professional. After we give them their treatment, as we all know, this is a one-way valve here, and you can only inhale and not exhale. So what's happening is when you spray the medication here, it's going to be kind of suspended in this area, and once the patient breathes in, it's going to be a one-way valve. It's going to go this way, the patient's not going to be able to blow that way. And so after the treatment's given, you take the inhaler, you wipe it down, you basically go on to patient number 2, and you basically repeat the process. By doing that, we are going to save the amount of medication that we are actually in kind of a shortage right now with our inhalers, and we're going to be able to go ahead and manage more people and be able to give more treatments.